Today we're going to discuss a very important topic, which is actually erythema multiform. So let's start it. Bismillahirrahmanirrahim. So basically, erythema multiform is actually means the erythema, but it has actually multiple forms, means multiple or many shapes. Actually, it is an acute condition but self-limiting mucocutaneous disease that was more frequently affect the young individuals and less often adults or elders. Means it actually mostly affects the young people. Okay. What is the cause? It is actually infectious. Actually, herpes simplex viral infections are one of the most common cause of it, and then mycoplasma pneumonia, which is very rare. Drugs is one of okay. Then sulfamides, drugs, anticoagulants, and in pregnancy the patient can also suffer from the erythema multiform. We have two clinical variants, which is erythema multiform minor, the other is major basically, and it is also associated with the herpes. The disease reoccurs in a 20 to 30% of the cases. Okay. Now, minor erythema multiform oral mucosa, how it appears? It actually multiple small vesicles, means the small type of vesicles, first of all they will appear, then they will rupture. When these vesicles ruptured, they have actually a painful erosion. Then this painful erosion is actually covered by a whitish pseudomembranes and other mucosa. So means they have multiple vesicles. These vesicles ruptured and then they were painful erosions and they were covered by a pseudomembrane. Okay, it can really affect the conjunctiva and genitalia mucosa, skins. On the in a minor form, the skin lesions appears to be erythematous, means reddish. Macular papules, means the macular papules appears presenting as a numerous target lesions or arrest-like lesions. Very important that in minor form there is a target or arrest-like lesions. Less often pruritic plaques or bulla that may appear. Duration of lesion may varies from 1 to 4 weeks. So it is in the skin, it is actually erythematous macular papules, and basically they present as a target lesion or arrest-like lesions. The pruritic plaques or bulla are very less often basically, and the duration of these lesions are 1 to 4 weeks. Major, how it affects oral mucosa. We have previously studied that in minor it is basically multiple small vesicles, they are ruptured, they are painful erosion, then these erosions are actually covered by pseudomembrane. Now in major, what happens? There are also severe but always present. Initially they are erythematous area, and then soon into vesicles. First it is in a reddish area, then it forms vesicles, the vesicles rupture again, they were erosive, and then it is covered by a yellow or white pseudo membrane or hemorrhagic crust. In that it was covered by a white pseudo. Here is actually also yellowish and white, and also a hemorrhagic crust, means a reddish type crust. Okay. Other mucosa like ocular, like eyes, genitalia, pharynx, esophagus, bronchi are usually involved with the severe lesions. How it appears? The skin. In skin, it is appeared like a contemporaneous target lesions. In that it was arrest-like lesions. They are usually lack the symmetry involvement of a non-typical area or longer duration. So means these lesions are not symmetrical. Okay, and they are non-typical areas, means not that mostly areas are affected, and longer durations. Okay, how you diagnose? It is basically on clinical features and histopath criteria. Differentials, it is actually primary herpetogingival stomatitis, herpetiforms, ulcers, bullous pemphigoid, and cicatrician pemphigoid. Linear IgA disease or P gestation, means pemphigoid gestation, epidermolysis bullosa aquesta, and drug eruptions. What is the basic guidelines on how you will treat this? The management include, first of all, you will actually identify the etiologic factor, and then you will eliminate. Either it can be an infection, either it can be a drug form. In minor, what happened? It is a self-limiting. First of all, basic guidelines. So need only symptomatic treatment, means you can give a symptomatic treatment, a drug. Okay. Corticosteroids, systematic corticosteroids, it is basically controversial, but it can be used in low doses that are helpful for oral lesions. Erythema multiform needs bed rest or hospital management is recommended. Antiviral therapy may eliminate the recurrence in some cases. Systematic treatment in which oral corticosteroids, like for 2 to 4 days. In minor erythema multiform, it is 20 to 40 milligram per day. Prednisone, it is administered for 4 to 6 weeks. Control the dose. The dose is then quickly tapered and completely stopped later than 2 weeks. In major, the dose is 4 to 80. In minor, it is 20 to 40. Okay, tapering 2 to 3 weeks, and in this you need actually 4 to 6 days to control, and the tapering is then basically, and then it is tapered, and then it is completely stopped not later than 2 weeks, I mean not more than. Okay, and this is erythromycin 0.5 or 1 gram 3 times per day. Antiviral uses 3 drugs. Acyclovir, which is 400 milligram, taken 2 times for 4 to 6 months in due to if herpes is suspected. Next, we have newer antiviral like valacyclovir 500 4 to 6 months, like in this it was 4 to 6 months. Then famiciclovir 250, which is also 4 to 6 months, twice daily, which is also effective. Topical treatments, you can give oral hygiene. You can give topical anesthetic like lidocaine gel, benzocaine lozenges, and basically mouthwashes like hydrogen peroxide, chlorhexidine. Topical corticosteroids, 0.1% triamcinolone acetonide or 0.05% includes actually clobetasol, propionate ornament, which also may have help to eliminate the discomfort. Alternatives like levamisole, thalidomide, azathioprine, and cyclophosphamide is also dipsazone, which can be also used mainly in chronic or recurrent diseases. Okay, so with this we have finished the erythema multiform.